As the COVID-19 pandemic continues, and with the threat of a second wave looming, it is important that we are all aware of the risks and that we manage them as we go about our daily lives. NIHR ARC East Midlands contributed to the development of the COVID risk reduction framework used by NHS England. Our director, Professor Kamlesh Kunti, was part of a group who created the Adult Social Care Risk Reduction Framework, which has been developed for workers who are potentially more vulnerable to infection or adverse outcomes from COVID-19. Links to both of these frameworks can be found below this video. However, identifying and managing risks isn't just for health and social care staff, but is something that we should all do. Although the risk reduction frameworks were designed specifically to help employers work with staff to assess the risk and threat of COVID-19 and to take actions to manage this risk, they can be used by everyone. Not only do they cover workforce and workplace assessments, but they also address individual risk assessments. Using the risk reduction framework can help anyone, including members of the public, to be aware of the increased risks of COVID-19 and make better informed decisions about how they might safely manage these risks as they go about their daily lives. In a paper co-authored by our director, the public were warned about a reasonable worst-case scenario of a second wave of COVID-19 this winter. The paper recommends that we all minimise and manage our risk by physically distancing, wearing face coverings, ensuring good hand hygiene and respiratory hygiene, heating and ventilating homes and workspaces, self-isolating if you have COVID-19 symptoms or a positive test, and participating in test, trace and isolation programmes. Given our expertise in risk reduction, we are pleased to be able to share our freely available work and resources in the hope that they offer useful knowledge and tools for others to use. In the following series of short films, we have responded to the main recommendations coming from both the risk reduction framework reports and have packaged our resources in terms of 3 themes. 1. Managing risks to the workforce. 2. Managing individual risks in relation to age and ethnicity. And 3. Managing individual risks in relation to underlying health conditions and multimorbidity.